511 cases in Victoria in the last 24 hours. That's 4,697 active cases of coronavirus in the state at this point in time. Remains a very similar pattern as recent days. 85% of all of our cases are under the age of 50, and a quarter of all of our cases are in their 20s. This continues to be an outbreak of young and active people. 95% of today's cases are in the northern and western suburbs. 276 of those cases are in the north, including suburbs such as Craigieburn, Roxburgh Park and Broadmeadows, again names familiar to us over the last few weeks. We have 185 new cases in the western suburbs, in Truganina and in Hoppers Crossing and other suburbs in those areas. And as the Minister mentioned, we have 38 cases in our southern and eastern suburbs, including in Cranbourne North and in Pakenham and Dandenong, and there's a significant response, of course, underway with local partners in those areas. We also have 9 new cases across regional Victoria, and I'll talk about those a bit more in a moment, and there are 3 further cases that we continue to investigate. They dropped late last night. In terms of the overall picture, again, 91% of our cases continue to be in the northern and western suburbs. 95% of today's cases are in the northern and western suburbs. That's the real focus of our ongoing activity. In terms of the 9 new regional cases, we have 3 further cases in Ballarat following a really strong day of testing yesterday. And can I just thank everybody who came out and got tested in Ballarat yesterday and again this morning. The 3 positive cases we have now means we have 9 active cases in total in Ballarat across 3 different households. All the 3 active cases today are known household primary close contacts. So that is a somewhat encouraging sign. Of course, we never like to see positive cases, but we don't have any mystery cases today in Ballarat following a really strong day of testing. We have 187 identified primary close contacts. Of those 9 active cases, 2/3 of them have already returned a negative test result, and I expect the remaining of those results to come through in the next day or so. We do, however, have around 30 exposure sites across Ballarat, so I would ask, please, the community in Ballarat to continue to come forward and get tested. Please check those exposure sites. Some of those active cases have been particularly dynamic over the last couple of weeks during their infectious period. We have eight testing sites now up and running across Ballarat, including a site at the Federation University at Mount Helen that will open up in an hour or 2. Again, my thanks to the entire local team that's down there, particularly the City of Greater Ballarat and Ballarat Health for their fantastic efforts over the last 48 hours. We continue to expect a busy few days ahead as we work our way through testing anybody who's got symptoms and anybody who's been to those exposure sites and anyone who's got concern about their potential exposure. We also have 2 new cases in Geelong. One of those is an employee at a call centre in Melbourne, so we're working through some contact tracing there. And the other, their source case is we're still inquiring and working out exactly where they've obtained the infection from. Their partner works in Melbourne. Obviously, testing results are due back for their partner shortly. We'll continue to watch those 2 cases very, very carefully. Both cases have had minimal movements in the community, so that's a somewhat positive step. We've also had 2 further cases reported in the Melbourne numbers earlier, who both live in Melbourne but travel to Geelong to work at an office building there. We believe transmission occurred at that office building. Again, and can I use that, yet another example again of really a call out to employers. We've had, there are very clear guidelines around what constitutes essential work. There are, of course, some essential jobs that are undertaken in offices that do need to continue in situ. But please, I'm asking all employers to consider very carefully before you ask your staff or require your staff to come to work. It is only if their work is genuinely essential, not it's just a little bit convenient. It's, again, a highlight of an example of 2 staff coming out of Melbourne, which is locked down, going into regional Geelong to work at their employer. It's something I would rather see less of if we could. We also have a case in rural western Victoria in the East Wimmera. This individual has been isolating very closely. They live in a fairly remote location. We have a pretty good line of inquiry around their possible source acquisition. We need to land that over the coming day or so. We also have 2 new cases in Mitchellshire. One of those is a construction worker in Melbourne, and the other is a result that came in late last night, and we're investigating that this morning. I should add that now makes us 11 active cases in Mitchellshire, all acquisition well understood, all isolating, and 13 active cases in Geelong at this point in time. So we are watching those two locations very closely to make sure we don't see any further seeding out in those two critical regional areas. Finally, we have one further case in the regional results today from the Latrobe Valley. It's an individual who works at 2 fast food restaurants in Traralgon. Acquisition is underway. Again, we have a pretty good line of inquiry back into Melbourne, but we'll confirm the details of that during the course of the next 24 hours. We have 36 primary close contacts in the area. 92% of those have already returned a negative test result. And again, my thanks to all of them for coming forward so quickly, for getting tested. And of course, we'll watch that case very closely. In terms of, obviously, with the closure or the lockdown in Albury, all Albury residents are now subject to those New South Wales restrictions. We continue to operate our Victorian border bubble between border communities. And of course, for those people who are in Wodonga especially, there are already restrictions underway in terms of what you're entitled to travel into New South Wales border bubble for, including Albury. I'd of course please stress again to Wodonga residents, only enter Albury if you absolutely must for an essential purpose, and we would of course much rather you minimised any movement in the Albury area at this point in time, recognising of course of our essential workers in our healthcare system and other key activities that will need to continue and will need to be mindful of their exposures as they do so. We also have now 4 examples in the last few days of truck drivers who have travelled through the Wodonga area in the northeast who have subsequently turned out to be positive, either in interstate testing results or Victorian testing results. We of course continue to provide a lot of support to the freight industry, critical interstate freight, both in terms of additional testing stations. I think there's 5 or 6 dedicated testing stations for the freight industry and additional vaccination opportunities for the freight industry. Critically important that this most critical of all services maintains very, very strict protocols around their activities and gets vaccinated very, very quickly indeed. And finally, in terms of the planned protests that are due tomorrow, and of course Victoria Police are leading the operation and the management of those issues, I can confirm we have 2,700 vaccinations booked in at Jeff Shed and at the Royal Exhibition Building for Saturday. People who are coming in for those vaccinations will be able to cross police checkpoints with evidence of their appointment. So please either do online evidence or you can print it off at home and use that. We are not, of course, taking any more bookings for vaccinations at Jeff Shed or the RAB for that particular day. So it is only those who are currently booked in. If you do not intend to attend for that vaccination appointment, that's absolutely fine. There are alternative appointments available on other days. We'd of course appreciate it if you could go online or give us a call and make those changes now, so we don't have staff standing around waiting for you to come forward. Finally, again, my thanks to everybody for the huge work that's going on. Significant and strong testing numbers, a lot of activity on the ground across all of our regions, particularly in the Metro Melbourne area. And my thanks to our very many local and state partners for the work they're doing to do all we can to minimise community transmission and particularly to control those regional cases I've gone through.